past 15 years, I have been a dialysis nurse, and it has been very alarming to see the increase in cases in kidney failure patients. Now, this is a responsibility of every citizen of Trinidad and Tobago. So in light of this, we are currently engaged in an activity today, World Health Kidney Day, and we are sensitizing everyone on ways that you could protect your kidney. So today we have the medical social worker advising you on different ways that you can access treatment and also the options of giving support. As well as we have the dietitian who today are going into detail as what you need to eat and what you should restrict yourself. As well as we have peritoneal dialysis team, so they will go into details what is peritoneal dialysis because it's a treatment option under the umbrella of dialysis. And then we have hemodialysis. They are going to explain the benefits of hemodialysis as opposed to peritoneal dialysis. So these are some of the services. Of course, we have the health education department who is often engaged in sensitizing the public as to protecting not only your kidney but all the organs of your body. So we need to keep in mind that before we reach hospital, there are a lot of things that we can do to protect our organs, our kidneys, and to be in good health so that we can offer good service to our family, our churches, our schools, and the community at large. You will also hear from two of our patients, Rebecca Welch and Gavin McIntosh, as to their experience and testimony during their journey of dialysis.
My name is Gavin McIntosh, and I am a dialysis patient at the Sangre Grande Hospital. I have been on dialysis for the past 6 months, and I must say, thank God for the intervention of this program that I am alive. To me, I can only speak about myself, but to me, it is one of the best things that I've come across. I have been on the hemodialysis when I just started and transitioned to the peritoneal dialysis, which was the best decision I think I have ever made. It affords me the flexibility of time where I can still work and come home and do my dialysis. It also keeps me in check. It keeps me in check to make sure that I stay focused and I do exactly what is needed to be done to continue a long, healthy life.
I was born with one kidney and I did not know. I lost my kidney at the age of 33 and it was a very painful experience for me. When I lose my kidney, my last daughter was 5 years old and it's 4 children I made. My journey of dialysis was a hard journey, very hard, because at that point in time, I could not pay for dialysis. I did kidney transplant in 2015, but that lasted 9 years. When I started back dialysis, I have to go dialysis 3 times a week, and that time I was using 2 needles. So when the needle, the fistula, it started to get bigger and bigger and pain. And if I did not shut it down, it would have burst from the inside, and that would have been dangerous to me. On that journey back in 2025, I've been on the ward about 8 times for 2025 because I always get an infection, upon infection, and my foot had a big blood clot where it was swollen very big. And every month on the ward, all the time on the ward. And then they decide the doctors and them find a patient who always sickly now. So they decide to keep me here to monitor me. On my journey, I asked God. What I asked God for is to live to see my children get big man and big woman. And he did answer me. So today, my oldest child is 26 and my last child is 20. When you ask anything in God's name, it shall be granted unto you. And that was my wish, to see my children get big. And 2025, I spent a lot of time on the board away from them. So I asked God now, give me a little more time to spend with them. Yes, I know I have to die one day, but I just want a little more time. Like what he gave the guy in the Bible when he asked him, and he had 15 years to his life. I'm asking God for a little more time with them before I depart this life. To those who now getting kidney failure, please hold the faith. Put God first in everything. Don't give up on God. It may be hard, but God is our source of our strength. That is why I'm here today to give kidney patients and cancer patients, all those who are sick, this word of encouragement. To the nurses in the dialysis department, the doctors, you all are wonderful. You all are doing a wonderful job. May God continue to bless you all. Because from 2011 to now, you all has not given up on me. You all always show me that love. And doctors, when on the ward, to answer your patient and understand. May God continue to bless you all.
Today we're going to talk a little bit about dialysis and what is dialysis. So the job of the kidney is to get rid of waste and excess water from the body. So if a patient has kidney failure, they are unable to get rid of this waste and excess water, so they may start feeling unwell because the waste is building, and those toxins may be damaging, their organs, their brain, etc. As well as they may start accumulating water, so they may have swelling in their feet and be short of breath and so on because there's water in the lungs. So once these patients have reached the end stage of kidney disease, we discuss with the patients ways to get rid of this extra waste and water from the body. And that is where dialysis comes in. So there are two types of dialysis. There is number one, hemodialysis, and the second form is peritoneal dialysis. So firstly, hemodialysis, the part of the word hemodialysis, hemo refers to the blood. So in this form of dialysis, patients usually come to the dialysis unit 3 times a week. So for instance, on a Monday, Wednesday and Friday, or Tuesday, Thursday and Saturday, where the dialysis team will connect them to the dialysis machine. Their blood is drawn through the machine through a filter, and through that filter extra waste and water are removed and clean blood is returned to the patient. And this continues for over about a 3-hour period, 3 to 4 hour period, and as I said, the patients may have to do this at least 3 times a week. So that's hemodialysis. However, the other form of dialysis is peritoneal dialysis. Now there's a natural filter that exists in all of our bodies, which is in the peritoneum, which is a lining that covers the organs within our abdomen. Through that filter, waste and extra water can also be removed. The thing about peritoneal dialysis, however, that it is done at the comfort of the patient's homes. So usually if a patient decides to do peritoneal dialysis, they will meet with our team, they will be educated, the patient and the relative, in how to do this process. And this process usually is done every night or sometimes during the day, but on a more frequent basis than patients who do hemodialysis. So with peritoneal dialysis, a sterile fluid is put into the abdomen and it draws out all that extra waste and water through the peritoneum, which is that natural filter that exists in the abdomen. And then that waste water and toxins are removed from the abdomen and flushed down the drain pipes at home. And as I said, it's done in the comfort of your home. So that's the simple difference between hemodialysis and peritoneal dialysis. But there's a very important part of what we call renal replacement therapy that needs to be mentioned, and that is called renal or kidney transplantation, where a kidney is taken from a donor who is either alive or has passed on, and that kidney is then transplanted or put into the body of the patient with end-stage kidney failure, and then that kidney is now able to get rid of extra waste and water from the system, so that the patient would not rely on hemo or peritoneal dialysis.